The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health with yours truly, Dr. Tom Roselle. I'm glad that you're here with me again. Got a great program for you, one that a lot of us worry about. A lot of us say, oh my God, what happens if this happens? I'm going to lose my eyesight. But what are we talking about? We're talking about retinal detachment, but more importantly, so you can differentiate the symptoms from retinal detachment to ocular migraines. Both situations are significant problematic, but we want to know, do we worry or do we not worry? Can we fix it? Can we not fix it? Obviously, the migraine patterns are significant. They can cause you to stop you from focusing properly. They can cause you to have a headache trigger pattern. They can lead into other situations. Their warning is often saying something else is not right. But retinal problems, if you lose your retina, there's an issue. Now, if you look at your eyeball, right? And your eyeball formation is due to a sac that's inside called the vitreous sac. It maintains that round shape. And generally, if you're about 50 to 60 years old, 50% of all of you have lost that vitreous sac, that mold, if you will, to keep your eyes nice and round and big. What it does, it drops down into the lower portion of the eyelid, and the body does what it's going to do with it, and it doesn't preserve a problem or problematic situation whatsoever. But I want to get into it so you really understand it, so you get what it is that we're talking about, because this can be really jeopardous if you ignore it, if you don't know what you're looking at. So we're going to talk about, as the program goes through today, we're going to talk about twinkle, twinkle, little eye. What does that mean? That means something is happening, but you got to know why it's happening to be able to correct it, to be able to deal with it. So let's get into it just a little bit. Let's talk about, what the problematic situation is. Let's talk about the one that we worry about the most, and then we'll kind of compare and contrast everything as we go through. Retinal detachments occur in approximately 10 to 18% of cases, or 10 to 18 cases, if you will, out of 100,000 people on an annual basis. Now, that seems to be really low, but there's actually other things that take place. So what I want you to understand is retinal detachment is a serious ophthalmological problem. It's a condition that the underlying support structures will be damaged, and it leads to loss of vision. So when we understand that, we can see what the seriousness of this is. The annual incidence, if you will, of bleeding, of the retinal area is estimated somewhere around 10.3 people per 100,000 throughout the world. Now, it can happen from a lot of reasons and so forth, but I'm going to give you the things that you need to look at and remember. So if we're talking 10 to 18 people per 100,000 on an annual basis, then your risk, if you will, of having a retinal detachment by age 85 comes out to be about 3.5%, something like that. And the incidence is still growing for a lot of other reasons that we're going to touch upon just a little bit. But listen, I want you to remember all the things we're talking about today, because a lot of you get really freaked if something is not right and you can't pinpoint it the way you're supposed to. So here's the deal. Coming up on the 18th, in about a week, I want you to remember that those of you in the area, we're inviting all of you, obviously, that you'd like to attend an in-house presentation at the Roselle Center on what? On migraine headaches, on regular headaches, on cluster headaches, but it's any kind of headache that you can possibly think of. And Dr. Qinglong Zhang and I will be talking about this from a natural platform, from a biochemical platform, from an energetic platform, from an obstructive platform. So give you the information that you need to get rid of these crazy headaches that you have on an ongoing basis. It's really important that you don't suffer with headaches. Chronic headaches and migraines are awful, and they stop you. They stop you from going to work. They stop you from doing any kind of movement. I mean, you say, well, I work on my computer. What happens if you have a migraine? Do you think you're going to be able to work on the computer? I don't think so. I think it is something that, is costly to you, to your employer, to your family, to society at large, because you become non-productive. And then think about all the medications that you put on to control those issues. We talked a little bit about in previous programs that they're going around injecting people in the musculature of the neck and the head to prevent migraines. And what are they injecting with? They're injecting with Botox. And we said that Botox is what? It's a poison to the system, and you don't want that anywhere in your body. So please, stay away from that. You'd like to talk about that on the 18th at 6 p.m. at the Roselle Center for Healing. All you have to do is, guess what? Register for the class. Go to drtomroselle.com. That's drtomroselle.com or rosellecare.com. And we'll have that discussion. So we're going to get into that on an ongoing basis as far as what you can do moving forward. I don't want you to suffer. I don't want you to have any headaches. And you can do a lot of things on your own to stop it. But you have to understand what it is that you're trying to stop to begin with, right? So let's get back in to talk about these crazy differences, if you will, between ocular migraines and retinal detachments. But let's go with the easy guy. Ocular migraines, if you will, are temporary disturbances in your vision. The problem is that it can lead to other problems, and what that other problem is a retinal detachment, which is a medical emergency, and it can lead to a permanent loss of vision if it's not treated immediately. The ocular migraine, which we often misdiagnose as a result of how it resembles a retinal detachment, is in itself a serious situation. But let's tell you what it is. Let's get through the process. Ocular migraine, by definition, an ocular migraine is also called visual migraine or migraines with an aura. Now, they can be a prodromal. They can lead into other types of pain patterns, and those are not cool. They're very, very difficult to deal with. So what do we have to look for? So we're looking for flashes, we're looking for zigzag lines, we're looking for shimmering spots, we're looking for twinkle twinkle little stars that that we kind of talk about and kid about, blind spots, and they can affect one or both of the eyes. Now, when these things come about, they last anywhere from 5 minutes up to an hour, and generally they resolve themselves. Now, the causes, according to the traditional medical literature, is spasm in the blood vessels of the nerves, around the nerves of the eye. Now, common triggers, according to the medical literature, are stress, hormonal changes, bright lights, certain foods, lack of sleep. But here's the deal. It's not just that. It also could be telling you that the upper part of your neck, the bones in your neck, the first cervical, second cervical vertebrae called atlas and axis are out of position, and they're compromising the blood supply to the optic nuclei, which is where your vision from the brain comes from. Now, ocular migraines generally do not cause permanent eye damage, and generally are not something they say, oh my God, I got to go have this taken care of. However, if they're there on an ongoing basis, you have to start thinking of the other things that may be accompanying that. Like, are you able to see clearly on a regular basis, or are your eyes beginning to change? That can be the next step with an ocular migraine, because if it affects the blood supply, which we just said it is, it can affect the visual pattern across the board. Now, how about retinal detachment? We said we're going to kind of differentiate the two of them. Retinal detachment, by definition, occurs when the retina, it's like, the film in the back of your eye, it can show signs of being disrupted. And some of those signs are the same thing as an ocular migraine. You get flashes, and you get these, those floaters that you see sometimes. Sometimes they're not a problem. Sometimes they're a very significant problem. You turn your head and you see these little guys floating around, and they don't move quite as fast, but they didn't follow. They go the other way, they come back, but they don't cut as fast. Those are floaters. So these flex, if you will, from one side and sometimes both sides. Unlike a migraine, they persist, and over a period of time, they don't resolve. They're all there. Generally, if you're having a little bit of a problem, you remember with that sac that I told you, that vitreous sac, it'll drop down just a little bit. And a lot of these floaters are a result of some vascular damage, but they usually, don't cause a problem. But in some cases, they do. And you have to make sure that you understand that. So what are the key differences? The key differences in something like this is there's visual disturbances, that will go from 5 minutes to 60 minutes, and they're temporary if they're if they are an ocular migraine. And they can, in the retinal detachment, they get much worse over a period of time. Eye involvement, one or both eyes in an ocular migraine. A retinal detachment is usually one side. Now, so if you see these floaters and they're both sides of your eyes, it may not be a big deal. Now, flashes and zigzags and squirming spots and so forth, that's your ocular migraine. Now, flashes with floaters and kind of shadow, all of a sudden you start to see a ghost effect. That can be a problem. That's called retinal. If you see, it looks like blinds, a shade with sunlight coming through, that's a problem with the retinal detachment. Now, with an ocular migraine, you can have headaches. You can have nausea. You feel like you're going to throw up. You have light and sound sensitivity. With a retinal detachment, and here's the difference, is a sudden disturbance in your vision without any of these other symptoms. Okay, let's go with that one piece again. With an ocular migraine, you can have headaches. You can feel like you're going to vomit. You can have light and sound sensitivity. With a retinal detachment, there's no headache, and you may have a sudden loss of vision. That's called get thyself to the doctor very, very rapidly, very quickly. Now, on the 18th, in our in-house program, we're going to go over this stuff in depth, and I'm going to answer your questions. Dr. Zhang is going to be your lead. This guy is amazing. He's a traditional Chinese medical physician. He is brilliant. He knows naturopathic medicine. He knows structural work, and he's really going to put it together for you. If you want any information from me in addition to that, all you got to do is go to drtomroselle.com and say, hey, Dr. Tom, I have this, this, and this. What do you think? Here's the other deal. If you go to the website, go to rosellecare.com, rosellecare.com. You're going to go to the top of the website, and it says there's a free 20-minute consultation. Call now. So what does that mean? That means there's no obligation. You want to talk to one of my doctors, no big deal. Give them a call and say, hey, I want to talk to somebody about my headache. I want to talk to somebody about my eye problems. I want to talk to somebody about these twinkle, twinkle little lights I have. I need to talk to somebody. We have a great team. I'm telling you, these guys are some of the best. I've been blessed. I get to learn from them, and we go back and forth on an ongoing basis. So go to rosellecare.com, and then the number's there, 703-698-7117, and say, hey, can I talk to one of your docs? And they're happy to do that. Listen, there's no obligation. We're not going to, sell you a timeshare online. We're not going to do any of that stuff. We just want to give you information. If we can help you in any way, lead you in the right direction. And I'm going to give you some of that information today and really show you what you can do to put the fire out. Hey, listen, it's great, right? It's an amazing opportunity that nobody else is going to give you, but we do here, because our job is to give you as much data as you possibly can. When I tell patients on a regular basis, they come in and we do an examination. Our examination, by the way, lasts about 90 minutes for the time that we get started with you. And the second visit, I sit down with you and I go over everything that we found. And if there's any lab work, I go over that and we do what we have to do. So you'll look at me and I said, here's what you need to understand. You now have the tools to turn things around. Let me explain to you in detail why this works and why you have a responsibility to yourself to do something outside of here. Now, we're going to talk about that tonight. I'm going to give you tools. I'm going to give you things you can try. I'm going to give you things that will make a difference. And you don't even have to call us. But look, here's the situation. We're in a world where people want control of their health. People want to be able to put their health in their own hands. They want to be able to do X, Y, and Z. But more importantly, they want to know why. Why are things taking place and things happening? It's your right to get that information. That's why we do this program. That's why we've always, been here. In front of you, if you're watching this online, you're going to see a couple ways of contacting me. One is socials at drtomroselle.DC, socials at drtomroselle.DC. The other one is online. You can do that there at drtomroselle.com. Or you can go to the website. You go to rosellecare.com. So there's a lot of ways of finding me and asking the questions that you need to know about. So tonight's program, we're going to get into all kinds of different things. We're going to talk about what you can do. We're going to talk about differentiating factors of conditions. In the next part of the program, I'm going to start giving you some nutritional approaches to prevent retinal detachment. Yes, you can do some things on your own that will make a difference so you don't go blind. It's important. Nobody wants to lose their eyesight, right? No one. And we start getting that older problem where we get cataracts and we start visional disturbances, and the eyeball itself begins to change form. Why? We just talked about it, right? You lose that vitreous attachment inside. It drops down. But look, if you have all these symptoms, these twinkle, twinkle, little shimmering of lights, flashing of lights, and so forth, it could very well be a problem. If there's pain associated with it, not as much. But if there's no pain associated, you got to get your eyeballs checked out, my friends, because you're going to suffer a consequence of ignoring it. You can't ignore this stuff. You have to do it the right way. So symptoms that look like one thing may very much be like something else. So retinal detachments and ocular migraines are similar. So when we get into the program, and after we come back from the first break, we're going to get into some of the nutritional components that really will show you major shifts and changes. Wouldn't it be nice not to worry about what happens to your eyes? Wouldn't it be great to know that, I can get this fixed? I don't know about you, but I'm looking to fix everything I can possibly can on an ongoing basis. It's important that you have the tools. It's critical that you step up and understand that health is a do-it-yourself program. That's why we hallmark this Ageless Health. Health is a do-it-yourself program. That was the title of my book. And you still can get the audio version, by the way. You can go to Ageless Health book or go to drtomroselle.com and go to the store. We've got some interesting stuff out there for you. And if you own this, it's going to give you tools. It's going to tell you how the body works. It's going to tell you what to do about it. This year is going to be a great year. Let's make 2026 the most powerful year that you have ever stepped into the pool with. Why do I say that? Because I'm dedicated to you. I'm going to give you all kinds of stuff. We're going to be lecturing all over the place. I want you to join us if I happen to get out in your area. And by the way, here's the deal. I don't care where you are right now, but if you're hearing my voice and you'd like me to come out to your church, your club, if you'd like me to come up to an organization, a group of people, we work in conjunction with a foundation called Caring for Others. And it costs you nothing, absolutely positively nothing. They put gas in my car and they give me a per diem for lunch, and they say, go teach people. We want them to have the information. Caring for Others is a Virginia-based 501c3, and we have dedicated ourselves to helping as many people as possible. So if you'd like me to do that, all you got to do is go to rosellecare.com, send us a note, go to drtomroselle.com, or simply do what? Go call us, 703-698-7117. Talk to Sybil McFarland, and she'll set it up for me. And we'll find a time that's convenient for all of us. And, whether it's at nighttime or whether it's lunchtime. Now, the only days I won't be able to do it would be a Monday, Tuesday, Wednesday, or if I'm out of town teaching, which happens, but I promise you we'll get it done. And whatever I can do to give you as much information as I possibly can so you can help yourself, your family, your friends, your churches, all your, I'll even do in-house medical presentations, and we do it through Caring for Others. So I want you to know it's available to you. I want you to know that this is our gift, our contribution to the community. That's why we work for Caring for Others. We're coming up to a real quick break just in a moment or two here, and I want you to know that the data I'm going to give you today, you need to take information down. You need to write it up, right? And then apply it. Then do what you need to do to make a difference. Remember, you have the ability to help yourself. Okay, we're coming up to a break. You're listening to Ageless Health with yours truly, Dr. Tom. Don't go away. I got a lot more information I want to share with you. I'll be right back after some very, very important information.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellcare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com.
Hey, everybody, welcome back. This is Dr. Tom, and you're listening to what? Ageless Health. And because you deserve to live the life you want to live, you deserve to have all the tools that are available to move you into that spot of wellness, not just getting rid of the symptoms, but wellness. That's why we do the program. We're talking about what? Ocular migraines versus retinal detachment. Why is that so important? Well, ocular migraines can be very painful. They could be very disruptive. They can cause you some issues. Generally, under the right care, they're resolvable. Acupuncture, structural manipulation, nutrition changes, things like that can make a huge difference if you find out what it's really all about and you're going to the right practitioner. Retinal detachment is a problem. Retinal detachment can permanently cause you your vision. And now you go from having been able to see clearly to not being able to see anything at all. So we have to make sure that we understand the differences. We talked a little bit about the difference between retinal detachment and ocular migraines, and one can be painful. That's generally your migraines. And the other one is no pain whatsoever, nothing. There's no disturbance. All of a sudden, you just have, these flashing lights. You have these cross pattern lines. You have things like that. And that's called an emergency. Get thyself to an emergency room, an ophthalmological surgeon now, yesterday. Otherwise, you stand the risk of losing your eyesight. So what this is all about is giving you the tools. Now, let's get into some of the things that you can do to protect yourself, which is really critical. This is the most important piece. What can you do to protect yourself? So we're going to talk, just kind of tiptoe into that a little bit. And there's, some nutritional approaches that you can help solidify, make more solid, do better with these retinal detachments. And you don't want to ignore it. Trust me, this is something that you do not want to ignore. So let's talk about that a bit and give you some of the things that you can get done. Now, one thing that I want you to understand is retinal detachments can come from either ignoring symptoms over a long period of time. You could have a blow or trauma. You could have been in a car accident. You could have, stuck your finger in your eye, and I'm talking about a traumatic situation, that vitreous sac that we talked about that pulls away from the eyeball and begins to shift and change the focus of the eye. That can be a problem because what it does is it pulls against the background of the eye, and now you've lost your sight. You can't mess with the retina, and don't ignore it because it's one and done. So let's talk about what you can do to help yourself. Nutritional approaches, right? So to prevent retinal detachment, you got to make sure that your diet, as you heard forever, a well-balanced diet and all kinds of nutrients. And that means get rid of the junk. Drop the inflammatory reaction. Make sure that you're eating things that optimize blood supply to the eyeball. And so you've heard of things, and I know you have. They're called lutein and zeaxanthin, and they are powerful carotenoids. Polyphenols, another word for them. Now, they're found in leafy vegetables and citrus fruits and all kinds of colorful vegetables. A lot of you don't like vegetables. Well, you better start liking them. And these carotenoids, if you will, they help filter the harmful blue light and reduce oxidative stress in the retina. So guess what? Where blue light comes from? It comes from your computers. It comes from your cell phones. If you're on those things a lot, you're causing damage, my friends. Now, they may make glasses that can filter it out. They're called blue glasses for computers and so forth. So go online and get them. We may have it through our website. Go into the different nutrition products that we have there and see if there's anything later on. But you have to have them. Now, they make supplements that have lutein and zeaxanthin in it, and you can take those as well. Vitamin C, very high levels. How much should you have minimally every day? Minimum about 500 to 750 milligrams a day. Say, well, my doctor said I get 100, 150. No, you're not good that way. It doesn't work that way. But you can eat foods that help as well. Strawberries and blueberries and, some of the citrus fruits. And it supports blood supply. Bell peppers, by the way, are one of the best things you can do. So you get an old-fashioned green bell pepper or a yellow one or whatever and start chopping on it like an old apple. Yeah, you heard me, but like an old apple. Vitamin E, good vitamin E. What kind of vitamin E? There are many different sources of vitamin E. Well, let me show you something. If you take it, and I wish I had a bottle here in front of me, but I don't. But if you look at a side panel on something, let's make believe that this says this is vitamin E. You're going to look at it, and if it says D, the letter D like David, alpha tocopherol, it tells you that it's a natural form vitamin E. But if you see a D with the letter L like Louis, alpha tocopherol, that's a synthetic. You don't want synthetics in your body. You want to get as natural as you can. A lot of them are cheap. That's why they use them. They don't work the same. The affiliation that it has for other systems and so forth is not present as much of it's in natural form. So you're going to look for D, the letter D, and then alpha, ALPHA, alpha tocopherol, tocopherol. That's a natural form. Then you're going to get D-alpha tocopherol succinate. You're going to get D-alpha tocopherol acetate, and there's others as well. These are different, they call them moieties of vitamin E. So check it out and add that. How much? You get a couple hundred units a day. That's usually plenty. Vitamin C, is the critical piece, and vitamin E is critical as well. So it's present in all kinds of things. You can eat nuts, you get vitamin E. It helps break down the free radicals, the injury to the system. And then the thing that we talk about all the time is your omega fatty acids. It's critical, and they're found in fatty fish, things like Norwegian salmon. And you can have a little bit of tuna as long as it's a small tuna. It's the albacore tuna. Why should you have a lot of tuna? The reason you should have a lot of tuna is because of the heavy metal in it, particularly mercury. Yeah, unfortunately it is. So if you're going to eat tuna, do it once a month, but that's it. But salmon, Norwegian salmon, free caught area, sardines, the little fish, all the little guys, even anchovies, they're great for you. Do things of that nature. You'll be amazed how it helps in keeping the inflammatory levels down in your eyes. It keeps the fluidity of the receptors. They're called photoreceptors that are in the eyes. That's so you can see, right? And then the last one, which is one of the most efficient things, and we test this on every patient that walks in our office, is zinc. So they're found in what? They're found in nuts, and they're found in legumes, beans, and they're found in really good fresh caught seafood, not the farm raised stuff. And they produce something called melanin, and it helps protect the eyes and produces the ability for you to see better at night. Isn't that cool? Yeah, it's kind of a great thing. So you got all these things that will help prevent retinal detachment. How great is that? So let's go over them again. We have lutein and zeaxanthin. We have vitamin C. We have vitamin E. You have omega fatty acids, and you have zinc. Just those guys, if you did it on a regular basis, will help. What's another source of beta carotenes? We talked about that just a minute ago, right? Carrots. Yep, bugs and company. Yes, it's very, very important. And we want to make sure that we help you help yourself. So there's a lot of pieces of the puzzle out there, and I'm trying to give you as much as I possibly can in a short period of time. But if you want to know more, join me and join Dr. Zhang on when? The 18th of this month. It's in a week, actually coming up in a few days, next Wednesday evening. I keep getting lost as far as time frames. But we'll be here at 6 p.m. at the Roselle Center. Dr. Zhang will give you more data that you can possibly think of, and then some, right? So we have to make sure that we eat well. We have to make sure that we take the right substance. We have to make sure that we don't ignore the things that happen. It's not okay. If you want to protect your eyes, it's definitely not okay. So, people say, well, what kind of diet should I have, doc? As far as I'm concerned, it's not because I'm Sicilian. The Mediterranean diet, it has a much easier adherence, and people are able to deal with it. And by the way, the Mediterranean diet, globally, if you look it up yourself, is associated with much lower levels of migraine frequency and the impairment, we can call it disability from migraines, right? So if that's the case, start eating all the stuff, and it ain't your pizza. It's not that kind of stuff. A Mediterranean diet is fish and nuts and whole grains that are sprouted grains, and so another garbage that we have here in this old good old United States. The omega fatty acids, things like fatty fish and walnuts and chia seeds and that kind of thing. And then guess what? The number one thing you've heard me talk about forever and forever is magnesium, and it's linked to migraine attack. Why? Because many migraines are vascular spasms. The restriction of blood flow. And when that occurs, your head hurts. So if that's the case, wouldn't it be nice to take something that relaxes? It's called magnesium. And then one of the B complex family is called B2 riboflavin. And it's in things like eggs and quinoa and mushrooms even and so forth. So it helps the brain. And by the way, anything that supports mitochondrial function of the brain will also support mitochondrial function in the eyes and the heart. So you can take things like coenzyme Q10 too that will work, that it's not a one and done, but it makes a huge difference. It does help repair damage that might be there and also preventatively. So if that's the case, get it done. Listen, if you're riding a bike and you're going out without a helmet, and particularly your children, or young people, don't suck it up and be a macho person. Put the silly helmet on. Back in the day when I grew up, everybody said, well, you don't need that stuff. You're not going to get hurt. Well, it's called brain trauma, but it also affects your eyes. This guy, one of my favorite singers, Andrea Bocelli. Now, he's blind, but the man was not blind. He was an attorney before he became a very well-known superstar singer. How did he become blind? He took a shot to the back of the head with a soccer ball. He was playing soccer, and it hit him square in the back. So they didn't know then, and all of a sudden he started losing his eyesight. If they had acted quickly, it probably wouldn't have happened. So migraine headaches, ocular disturbances, loss of vision can be from any trauma or blow to the head, particularly to the back of the head. So get with it, my friends. Figure it out. Make sure that you're taking the steps to prevent any kind of injury. So it's important. If you had a bump to the head, make sure you go get your eyes checked out. If you start seeing, twinkle, twinkle, little light, make sure you go get your eyes checked out. Don't wait. Do not wait. As we talked about earlier, the incidence of detachment is significant. You have over a 3% chance in your lifetime to have a retinal detachment by the time that you're 85 years old. And that's just with normal biochemical tissue breakdown. That's not even the ones that are induced to trauma. So get it done, right? The incidence increases with age, but because we get silly and don't really pay attention to our dietary patterns. Men are more frequently affected than women. And that has to do with trauma patterns and machoism and so forth. There was a study that came out of Great Britain some years ago and said that 14.8 men out of 100,000 would have retinal detachments, opposed to 8.4 per 100,000 in women. And, we don't want to be, problematic here, but race seems to have a higher incidence. White Anglo-Saxon men have a much higher incidence of retinal detachment compared to African Americans or Black people. Now, we're talking about in the white race, 17.9 men to 18 men per 100,000 end up with degenerative retinal detachment, things that happen over a period of time. So pay attention, guys. Is it because that we lead with our heads all the time? Maybe. I don't know. But we better figure it out. We better understand that we have an issue here. Ocular surgery, there's risks, right? When you do cataract surgery, that can dramatically increase your risk of retinal detachment. And that's not with the upper things that, the risk levels that we just got done talking to. Myopia, okay? High myopia stretches the retina, making it much more prone to tears and breakdown. Trauma, we talked about that. Diabetes, specifically diabetes. You can go blind with a diabetic problem, and it causes a tractional detachment of the retina. All these things are real, and it's not me making it up. This is straight up the way it is. So does it happen at a certain time of the year? Well, there seems some suggestion that there are seasonal variations. The more cases are reported in the spring and summer. Now, could that be because we're more active and we bump our heads more? Maybe. Could it be due to the higher temperatures? Maybe. Could it be increased sunlight and damage, to the eye, and we don't have our glasses on? Problematically, yes, perhaps. And how about lower atmospheric pressure, which is going to cause a aberration in the pressure gradient of the eye? Possibly. So we got to start thinking about the things that may be an issue. We're coming up to a break. Look, this is an important subject. It's one that I'm trying to save your eyesight with. It's super, super important that you pay attention. If you don't have any pain and you suddenly see twinkle, twinkle, little star, go to an emergency room and get your eyes checked out like right then so you save your eyesight. Look, we're coming up to a break and we're going to wrap it up and put things together, in a few moments. Don't go away because this is really important data. I want you to have good health, good eyesight the rest of your years. You're listening to Ageless Health with yours truly, Dr. Tom Roselle. I'll be right back. Don't go anyplace. Stay right there.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Red wine is high in a substance called resveratrol. The so-called miracle molecule found in red wine might help improve mobility and prevent life-threatening falls among older people. Mobility problems are particularly common among older people who have Parkinson's disease and other age-related neurological disorders. The research says that this important finding could lead to the development of a natural group of products designed to help older Americans live safer and more productive lives. But before you stock up on red wine, Dr. Jane Kavanaugh says that you can get this naturally occurring substance in larger and pure amounts through dietary supplementation. Red grape juice, red grapes, blueberries, and nuts supply the same amount of resveratrol as red wine. If you're trying to stay upright, do core training exercise, eat your veggies, take resveratrol supplements, and drink red wine in moderation.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellcare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Hey everybody, welcome back. This is Dr. Tom. You're listening to Ageless Health with me, right? We're getting through the process of giving you the tools, the ability, the capacity to be able to take care of yourself because you should have that information. That's why we do this program. Listen, I want to remind you that if you go to drtomroselle.com or you go to rosellcare.com and you go at the top of the toolbar, there's something that says Ageless Health Store. And I want you to click onto that and check it out and see if there's things there that will make a difference in your life. Why? Because I use those products. My family uses the products. And you go in, there's a site there. You can go in and you click in, you put your email in, create your own password, and you can buy all kinds of stuff. It's called Full Script, right? And you say, let's say, hey, doc, where can I get a good vitamin E? And I'll say, go to Full Script, click on, those of you who are not patients in ours, and check it out. How about a protein powder? You have multiple choices on there that you can end up buying the things that you want. Go to Full Script. It's under the flag at the top of our toolbar. It's called Ageless Health Store. And if you go through the whole platform there, you're going to find filters, you're going to find all kinds of stuff. And it's going to greet you, by the way, with 4 products that I've recommended to my patients for a long time. I recommend to my staff. I take one of each one of these every day, keep my immune system nice and strong on an ongoing basis. So why don't you order them? Why don't you make a difference in your life, the health of your family, and so forth? Go to the Ageless Health Store, hit full script, or find out anything else that you want to find out there. If you have a question, call me, and I'll tell you what to do with it. Let's get back into the program. I want to wrap up a few things for you. We've been talking about the differences and the incidence of different types of problems, retinal detachments and ocular migraines. And, we talked about trauma-induced. We talked about the pulling away of the vitreous sac. We talked about different seasonal changes. We said that white guys, have much more problematic situation with this than any other race or culture. We said the Mediterranean diet is one of the best to prevent it. So you got to eat right, get rid of the junk, the sugars, the sodas, the coffee, the black teas, fast food, fried foods, alcohol, gluten additives, all the junk. You know the drill, right? You know where it's coming from. So if you have the tools and you can use nutritional products to help yourself with, why would you not want to do that, right? We talked about taking things like lutein and zeaxanthin, vitamin C, vitamin E, omega-3 fatty acids, zinc. Go online and check it out. There's one of my favorite companies. There's 2 of them, but the one I'm going to tell you about today is Bionics Laboratories, and you can find their products online at that store that we just talked about. Check it out. Get some of these things. Good vitamin C for you, but good clean form. Don't go to Costco. Don't go to the corner grocery store. Go to CVS or anything like that. That's garbage stuff. They rarely produce anything that is natural, that has good combinations, that wasn't processed badly. Trust me, use the product lines that we use, from Bionics Laboratories. And so Pure Labs has some good products as well. So you want to make sure that you give yourself the availability of the best of the best. Coming up this Wednesday evening, real quick now, right? In a couple of days, we're going to do an in-house program at 6 p.m. Dr. Jinglong Zhang will be your presenter, your primary presenter. He's going to be talking about what? He's going to be talking about migraines and other headaches, the things that go bump in the night, if you will. This guy is a master. He's a traditional Chinese medical physician. He is an acupuncturist. He's a chiropractor. He's a naturopathic physician. This guy knows his stuff inside out, upside down, and backwards. Join him. Join us here at the Roselle Center. I promise you, you're going to walk away with more data, more information, things that perhaps you didn't even thought about. And so I want you to have those tools, right? I want you to be able to get that done. When you realize that the incidence of migraines is so high, remember, retinal detachment could be laying there waiting in the back. Make sure you don't put off. You get your eyes checked on a regular basis. If all of a sudden you're not seeing like you want to see and it's starting to get very not there, don't wait, please. It could be a true ophthalmological emergency. If you get to it quickly, in today's world, you can save your eyes. Take the nutrition that we talked about. If you ignore these things, if you've had a blow to your head and you notice after that it's not working, if you see these little squiggly floaters that are just in one eye over the other, it's a problem. Your body's trying to tell you something. Do not ignore it. Do not ignore it. The epidemiology of retinal detachment is really pretty straightforward. You got to look it up. Look up the risk factors. Look at all those pieces. We fortunately have the ability to check this stuff out. If it's a structural problem, if the cranial plates, the bones of your head are locked together, so putting pressure on your eyes, if you're in, even a TMJ, temporomandibular joint problem, can provoke all kinds of pressure within the eyes and the side of the head and so forth. Did you know that? I'm telling you that it can be quite significant. So when you have an overall risk level in the good old United States of over 3%, by the time you hit 85 years of age, I don't know about you, but that's a whole lot of risk I don't want to take. I like my eyes and I want to keep them in a good place. I read a lot. I make sure that I have the ability to filter and keep it at a high level. Look, please, my friends, don't ignore this nonsense, please, because this is something that's going to cost you more than you want to even think about. It's not okay. We talked a little bit about nutritional factors, right? And the things that you should be eating, green leafy vegetables on an ongoing basis. And here's another one. Make sure you're well hydrated. If you're not hydrated, your eyeballs are going to be very, very dry. But the fatty acids are critical. The vitamin E is critical. The vitamin C is critical. The zinc levels, keeping them up. We do a zinc test on everybody that walks into our office as a new patient. How do we do that? We get something called zinc sulfate. And we put a little bit of zinc sulfate in their mouth, and I watch and I say, let me know what you taste. If they don't immediately go, oh, ugh, the worst thing I've ever tasted in my life at a very high level, then their zinc levels are pretty low. And that's the way zinc tastes, by the way. So it's not bad for you. It's just the way it is. So at that point, guess what? You dramatically are increasing your risk of retinal detachment. And by the way, many other degenerative conditions. So if it's the case, get it done, guys. Let's figure it out. Let's see what we can do to help you. And I want to remind you again, and this is what we do. Many of you say, why do you guys do what you do? Well, because after almost, coming up close to 5 decades of practice, not quite there, but coming into that range, I've dedicated my life to trying to make sure people have all the information. That's why I wrote my book, Ageless Health. Health is a do-it-yourself program. That's why I go out and I speak. That's why I keep teaching. That's why I go to the different universities. I talk to docs all over the place. I teach overseas. But I want to teach you. I want you to be able to do your own homework. You know what I tell people on platform all the time? My job is to provoke you. My job is to make you question me and everybody else that you hear. I don't want you to believe anything. I don't want you to believe me. I don't want you to believe, all these guys out there and good people, really super people like Dr. McCullough and Dr. Artis and so forth. I want you to challenge their position with information. And then and only then, when you've looked it up and you hear it makes sense and you have ownership over it, that's when you should follow what somebody is telling you to do. But not until then, because one size does not fit everybody. It just doesn't. So we talked about the differentiating features between retinal detachment and macular problems, a little bit, but ocular migraines more than anything else. Please, please take this program very seriously. And remember, everything we talked about does not step up to everything. What's everything? Those are all the blows and the traumas to your head. Those are the pressure gradients. Guys, if you're scuba divers, if you've ever been a scuba diver, if you go skiing at the top of a mountain and you're 11,000 feet, 12,000 feet, the pressure gradient is very different. So you add those situations to the things that we've been talking about tonight, and guess what? You just increase your risk exponentially. So let's do something about it. Let's make sure you have the capacity to be able to resolve virtually anything that you want to resolve. Make sure that you take the action steps and take some of the zeaxanthins and the vitamin C and the zinc and the beta carotenes and so forth. Wouldn't it be great to have your eyes function at age 85 like they did when you were 25? I'd love to have that done. I keep doing it. You see me take my glasses off and on, off and on, off and on. So after a long time of reading today and doing those things, and I can see, I'm well into those years that we all get a little afraid of, but I can still see, and I don't have any problems driving. And I had a godfather once say, "Well, I can still see the big things." I hope you can see more than just the big things. It's not okay, right? It's not okay. Listen, we're coming up to the end of the program. Don't forget, caring for others. If you want us to come out and talk to you, we'll be happy to do that. That's what we do. That's why we're here. Love to get it done. Love to meet you. Those of you outside the area, I'll drive to you. Trust me. I like going for rides. We'll get it squared away. We'll come up and say hey and get that done. We're coming up to the end of the program. I'm here every Saturday, same old time. And we're on other channels, by the way, and we're going to let you know more about that as we go through. But I'm here for one reason. You deserve the information on an ongoing basis. But one thing more important than anything else, and I am dedicated to you, and I love you all. You have a wonderful, wonderful weekend. Enjoy it. I'll be back here next week. Take care of yourself. See you soon. Bye.
There's two kinds of love in this world. There's the kind you want and the kind you need. But everybody has the capacity to be kinder to one another. Did you feel like heaven